Hi, I'm Gary Bebow, CEO of WRHS Health System, and this is the January 2018 CEO Connection. Today I have with me as a guest Dr. Chris Steele. Dr. Steele's an anesthesiologist on staff, and he joined us in 2011, so some 6 years ago. I think probably before we get started, I need to do a shout out to Amanda, Chris's wife, and his two children, Paxton and Violet. Chris is really blessed having a wonderful family, and I've gotten to know both Amanda and the kids over the years, and they're really a great group. So here's a shout out to you. So hey Doc, when you first came here back in 2011, you took on a major responsibility in anesthesia. I know prior to that, well, the anesthesia needed some leadership, and so refresh with me a little bit what's happened over the last 6 years as you've taken on anesthesia here and where it is today.
Well, I was very blessed when I got here to be working with a very professional group of CRNAs, the strongest I've ever worked with in my career. We've got right now 12 CRNAs, about to have a 13th, and they function at a ridiculously high level, so that definitely makes my job much easier. When I came here, we were in a void of anesthesiologists. I was the only one at that point in time when I came in, and tried to learn the system, work with the surgeons, try to build rapport, and over time developed really strong relationships with not only the CRNAs but also the surgeons and other specialties over time. We started by figuring out what the surgeons really thought we needed to do to improve our care and work on ourselves. We worked on internal quality measures at the beginning, worked on some efficiency strategies, and then really started trying to figure out how to take our care to the next level. As you know, with your help, we got into the perioperative surgical home about 2 years after I got here, and that's a program that the American Society of Anesthesia partnered with Premier on, and we were one of the original 20-something hospitals to get involved with that. And that was able to let us standardize our perioperative services for anesthesia, not just taking care of the patients while they're asleep, but really standardizing the care, working in collaboration with surgeons, dietitians, therapists, pre-op nurses to standardize their care before surgery, and then working with discharge planners, care coordinators, and their post-discharge care facilities in standardizing their care post-discharge from the hospital. And that has really snowballed and been really exciting.
It's been kind of one of the leading organizations in the country, really. I mean, I know several people contact us, and we go out and speak about our success to really give them some help move them along as well. You know, since 2011, it's amazed me on just how well you've been received by not only the CRNAs but the surgeons, and what a positive impact you've made here. It's frankly it's really impressive just what a wonderful impact you've made. You know, starting in January, you become our chief of staff for the next 2 years, at a time when I think the opportunities are really terrific at White River Health System, and particularly for us to take advantage of those opportunities, it's going to require collaboration between the doctors and the hospital and other providers of healthcare. And so, in terms of your agenda for the next couple of years, how do you lay that out?
I was very fortunate as far as chief of staff to be really learning under Jeff Angel. He's been chief of staff for the last 2 years, and he's done a really good job. He's been very engaging and really taken his role as chief of staff very seriously. He's studied the bylaws and really worked to make sure the staff had a voice, and I think that's something that they are really happy with what Jeff's done on that, and I hope to be able to do a similar job that Jeff did. I think the biggest thing I'm really working on is building on the momentum that our staff already has been moving toward, and I'm really proud of the organization in our improvements in quality over the last couple of years. You know, a few years ago we weren't rated highly from a quality standpoint, and we obviously believed that those numbers didn't reflect our actual care delivered, but we've improved our quality as far as readmission, mortality, and all the major qualities to close to the top quartile in pretty much everything, and recently named a 4-star organization from a quality standpoint. what I really want to work with on the staff coming up over the next 2 years is to continue our push to improve quality, but also to try to get value-based care involved in their vernacular or the way they're thinking. Right now, it isn't just about improving quality, it's can we improve quality and decrease the total cost of care. Healthcare is spiraling out of control from a cost standpoint, and we all see that. And as physicians and providers, we do have the ability, when we focus, to avoid some of the duplicative care, some of the excess tests, and actually make quality better by decreasing readmission, which lowers the cost of care. Now, we're working hard with the quality department to get the quality data, but I'm interested in engaging the finance department in trying to show how each staff member can not only continue to improve quality, but how we can deliver a more affordable product to our customers at the same high level of care. And it's a big challenge. I know a lot of organizations are wrestling with it, but I think seeing how nimble our staff has been with quality, I really anticipate good results with this new push toward value. So it'll be fun.
Well, clearly we all got to figure out how to provide higher quality of care at lower cost, and so it's an opportunity for all of us, and I really look forward to the next 2 years working with you, Doc, and really making some terrific strides going forward. So I want to express appreciation for you coming and being with me today, and look forward to these next 2 years.
All right, but it should be fun. I'm looking forward to it as well.
Thank you. I have 2 Employees of the Month to recognize. First, at Stone County Medical Center, Misty Whitaker, who is a coding patient access department employee, who has been recognized for her 13 years of service. She's noted for always helping in different areas of her department and outpatient clinics, and just a great team player. At White River Medical Center, I'm really pleased to report that Amanda Whitaker, my executive assistant, has been selected. She's been with us for some 2 years, and she's been recognized for prompt service. So if you see Misty Whitaker or Amanda Whitaker, be sure to recognize them for their award that they've received. We have a new physician joining us in January. Bennett Rudorfer is a interventional cardiologist. He'll be located out with White River Diagnostic Clinic and will practice along with Dr. Kirkendall, Boyke, and Stoyaglu. So when you see Dr. Rudorfer, be sure to welcome him aboard White River Medical Center. It's really important that all employees are aware of the nursing scholarships, tuition reimbursement, and other ways that the White River Medical Center assists in advancing their education. So I might want you to, if you're interested in that, to either contact the foundation or Human Resources to learn more about those programs. What a great way to start 2018 and working at continuing to advance your career. So be sure to take advantage of those opportunities. An employee engagement survey will be mailed to all White River Health System employees on January 14th, 2018. The survey will come to your home. It'll be completely confidential, and I really ask you to complete it and send it back in so that we can benefit from your feedback, and that you'll help us become a better hospital for you as an employer. So when you receive the survey, be sure to make a priority and complete it and send it back in. We'll look forward to the results, and we'll obviously share those with you right after we get them. We've had a couple of advances in technology at White River Medical Center. First, we now offer Micra transcatheter pacing system, the world's smallest pacemaker at White River Medical Center. And also, we recently acquired the Da Vinci X surgical robotic system that will assist surgeons in care for their patients. So these 2 new advances should really help us stay state of the art in technology. Finally, January is Cervical Cancer Screening Month. It's also National Blood Donor Month, and finally it's Thyroid Awareness Month. So in those departments, be sure to be aware of those events, and let's recognize those departments during this month. At Stone County Medical Center, I have a couple of updates as well. Pulmonary rehab has been added at Stone County Medical Center and is offered along with cardiac rehab. APRN Callie Taylor will start Friday coverage at Stone County starting January 5th, and she is available from 7 a.m. to 5:30 p.m. at the Mountain View Family Practice Clinic. For further information about things that are happening in and around White River Medical Center, you can view the White River Health System calendar on Facebook and our website, whiteriverhealthsystem.com. That concludes my CEO Connection for January 2018. Thanks for watching, and as in the past, if you have any suggestions on how we can improve it, please let us know. So have a great month.